So what is cultural safety and why is it important in healthcare?
Cultural safety for me as an Aboriginal woman is about my people walking on this country as safely as they did prior to the colonisation. In regards to health professionals, it's about them developing the necessary knowledge, skills and attitudes to be able to work effectively with Aboriginal and Torres Strait Islander people. There's a couple of components of that, Narelle, for me and for my understanding. It's health professionals understanding how colonisation has impacted on the formation of their attitudes and beliefs and underlying assumptions towards Aboriginal and Torres Strait Islander people, and then committing to developing those with the correct information. It's important. The important vehicle for health professionals in achieving that is critical self-awareness, and that's an ongoing learning journey. So that universities have a critical part to do that, but also professional organisations post-graduation also have a critical role in playing that. The most important component of cultural safety is that it's actually determined by Aboriginal and Torres Strait Islander people. So in the university, we can teach the necessary knowledge, skills and awareness and increase students, health professional students' cultural capabilities, but the assessment of whether they're delivering culturally safe care can only be determined by the end user, which is the Aboriginal and Torres Strait Islander person, family and or community.
And just as a follow-up question, what do you say to people who push back on the need for a definition or a shared understanding of what cultural safety is in health education programs?
Yeah, there's been a couple of issues that have come up through our consultations that we've been doing through APRA. And for me, given that I have the privilege of working across a large faculty at Griffith University, we've got 8 schools in the health group and 23 undergraduate disciplines. So I hear a number of different conversations and I see a number of different definitions of what cultural safety is for different disciplines. And what I've found is that the conversations around terminology are actually preventing us to progressing to actually addressing cultural safety. So I think a shared definition is really important in that respect. I also think a definition that is specific to the context of Aboriginal and Torres Strait Islander people in Australia is important. And one of the criticisms that we had through the consultations was New Zealand already has a definition where it was coined through Irahapati Ramsden. Why are we developing another definition? So historically, the journey of cultural safety is it's been nuanced for different disciplines and it's been used for different contexts. We wanted a definition that was specifically for the context of First Peoples in Australia, and a very clear difference between First Peoples in Australia and First Peoples in New Zealand is the colonial experience first and foremost, and also the fact that we don't have a recognition in the Constitution nor a formal treaty agreement, which means the formation of attitudes, beliefs and underlying assumptions is actually exacerbated because we don't have those foundational documents which ensured a commitment to addressing these issues much earlier than where we are now.
And recently there was a consultation on embedding within the national law that we work under to recognise Australian First Peoples Australians within that national law. That would be a very big step forward, I would have thought, in terms of cementing the importance of cultural safety within the health education and regulation space.
Critical, absolutely pivotal, and ironic that we'll get recognition within the Health Professions Act before we'll actually get recognition within Australia's health constitution. But importantly, it shows the commitment from Australia's health professions is an important focus that we need to take in that.
Yeah, absolutely.